late cocking, again, begins when the front foot hits the ground. You have further external rotation of the arm, and it ends when the shoulder is maximally externally rotated. Okay? I'm lefty, by the way. Okay. All right, phase 4 is acceleration. So that's when the ball actually begins to start moving forward. You have adduction and internal rotation of the shoulder. So this and this. And it ends when the ball is actually released. Deceleration begins when the ball is released, and it ends when the body motion stops. So, you know, there really hasn't been a lot of consensus on, is there any evidence out there that poor pitching mechanic actually leads to injuries? You know, it always seems intuitive, but, you know, is there any evidence? So the evidence certainly showed that pitch counts led to injuries, but what about pitching mechanics? So this is David Beckham's wife, and that's not very good pitching mechanics. But, so there's a good study in 2009 in the American Journal of Sports Medicine that aimed to evaluate poor pitching mechanics and see if they're a risk factor for injuries. They looked at 5 common biomechanical pitching parameters, and they tried to see if that correlated to excess force in the shoulder and the elbow. And they also looked at pitching efficiency. Okay, so what are the things they looked at? So the first thing they looked at was leading with the hips in early cocking. So proper technique was described as leading with the actual hips, as you see here. Improper technique was straight up. Okay. The second thing they looked for was the hand on top position in early cocking. So here we're seeing in early cocking the hand on top of the ball so you cannot see the ball, rather than where you're showing the ball and what we call supinating the forearm. Okay? So this is correct and incorrect. Third thing they looked at was max elbow height by stride foot contact. Okay, so when the foot is coming down, you should see correct is elbow at its maximum height. Incorrect is if that elbow is down. The fourth thing they looked at was the shoulder position. Was it closed or was it open at that foot contact? So here we can see proper technique would be a closed shoulder. Improper, open, so you're seeing their chest. The last thing they were looking at was stride foot, and whether it was pointed towards home plate or away from home plate. So we're seeing here that that's coming down and it's going to be pointed towards it rather than pointed away from home plate. So those are the 5 things that they looked at. So results. So they broke down the results into youth pitchers and adolescent pitchers. So what they noticed that adolescent pitchers, those 14 to 18 years old, performed more parameters correctly than the youth pitchers. So there's no question that you know, experience helped them out and that they were able to perform better technique than the younger pitchers. The youth pitchers, so those 9 to 13, those who had better pitching mechanics, they generated lower shoulder and elbow forces and more efficient pitches than those with improper mechanics. Okay? So definitely, I don't think there's any question in the study. Now the question is this isn't directly related to injury, so it's not like they followed these out and said these people will get injured or not injured, but they're basically looking at repetitive forces to the shoulder and elbow, and obviously we want to try to minimize those. So certainly more studies need to be done, but I think that we can safely say that there's something to be said for trying to have good pitching mechanics, and that it probably does matter. They looked at probably what was the 2 most important things, and it really seemed that the hand on top and the closed shoulder position were probably the 2 most important parameters. All right, so big topic, so curveball and sliders. So everyone wants to know, is this okay? When should you be able to throw these? Is it safe? So the conventional belief was that curveballs and sliders were really stressful to the elbow, more so than other pitches. Right? But recent studies showed, there's 2 recent studies in 2009 that really showed that the pitch that showed the highest forces in the shoulder and elbow was the fastball. It wasn't the curveball. So when fastball is the most force, then curveball, and then changeup. Okay? So, you know, what does that mean? So, you know, one suggestion of that is perhaps the pitch count is probably the most important thing. I think that's probably true, and I think most people would agree with that. You know, the problem is that there's been plenty of studies in the past that showed that, well, okay, they didn't assess whether the forces were higher, but they just looked at people who had elbow pain and injuries. And those who were throwing sliders and curveballs earlier, their risk of injury was just a lot higher. You know, I don't think it's really conclusive now, but I think until we get more information, the standards are still the same, which is that it's recommended that curveballs really should be avoided until age 14, or they say until shaving, because I mean, you know, you look at some 14-year-olds are quite different compared to others. You know, you have others that are 6 foot and shaving, and you have others that, you know, are 5 feet and not even close to that. So I think what we're looking for is some amount of development and puberty. And they recommend that sliders should be avoided until age 16. So questions about this? Yeah.
Could that be a direct result of poor technique taught by the coach on how to throw a curveball or slider? Which I'm not advocating a 9-year-old throw it.
Yeah. My guess is, you know, so like the study I showed before showed that younger pitchers had poor mechanics, no doubt. So they have poor mechanics, and my guess is you're right that that's part of it. That either one, they don't have good mechanics. Two, they might not be taught the proper mechanics. And they're probably trying to add that into the rest of their pitches. So you're just kind of poor mechanics, increasing the number of pitches, and all that probably summates to, you know, more problems. But you know, kids are going to be different. You know, I mean, so some 14-year-olds might not be, you know, very far along developmentally. They have poor mechanics, and they might not be ready for it. And you might have a 12-year-old that has perfect mechanics. You know, it's gone through puberty, and they might be ready for it. So it's kind of hard to tell, you know, but they have to kind of choose a general number to try to advise people on. And so 14 is it. But I think the mechanics certainly could be an issue.
You also made mention about the changeup. What's your thoughts on the changeup at a younger age?
Well, I mean, it hasn't shown to be more stressful at all. I mean, that's the least stressful of any of those.
Right.
So I haven't seen anything in the literature that shows that that's something that should be avoided. Do you have concerns over that?
No. It's the group that I'm affiliated with. We teach the younger kids to change their fastball because your arm is naturally going into pronation as you're following through. So that is the typical follow through, and that's how you throw the changeup.
Yeah.
So you're going with it.
Yeah, I haven't seen anything that suggests that that's a problem at all. And so I think, you know, as far as like, you know, that gets in here, what's really the kind of keys to successful pitching? And so it's development of a fastball, accuracy, off-speed, change-up pitch, you know, so these are the things that you should probably be focusing on, and changing speeds and plate locations at a younger age, rather than trying to throw in pitches. I mean, because really they should be mastering those pitches probably before adding in, you know, a curveball. Other questions about the pitch count? Any other questions on anything else that I went through here? Because that finishes my portion of the talk. So if you guys have any other questions, feel free to just grab me at the end of the discussion. And now we'll move on. Dr. Davis will come up and continue on.
Thanks everybody for coming. My name's David Davis. I am a recent transplant from Boston and happy to be here now helping with athletes in this area. So my focus is going to be on injuries and how we treat those non-operatively, and then some operative, you know, indications for surgery and things like that. So I'm going to try, in the interest of the fact that we probably all have limited attention spans, mine included, I'll try to do this pretty quickly. So we already went over throwing mechanics, so I'm not really going to focus on that. Again, just another cartoon showing the phases. And the only reason I mention these is that the different phases of throwing, and when you have pain in those phases, sometimes points me in the direction of what the injury is. And whether it's a labral problem or a rotator cuff, or it's a problem with instability. And so that's why it's important in this discussion. I'm going to try to use the least amount of anatomic terms possible, but we can only get away with so much. So if something doesn't make sense, you just yell at me or raise your hand or something. So here's a little diagram of shoulder, basic anatomy, and then some injuries. And we're going to talk about 4 primary things: the rotator cuff and injuries associated with that, instability injuries, labral injuries, and the last entity, which is called little leaguer's shoulder. Say that fast 5 times, it's really hard. So, and then briefly, if we have time, I have a few slides on elbow injuries in addition, which is also very common. This is just from an anatomic perspective, which Dr. Heaton did a great job, just so when we start talking about the labrum is this kind of, I call it the washer of the shoulder, and it's around the socket portion. If this is the socket, and this is the humerus, if this is the ball and socket joint. The labrum is what helps the humerus, or your arm bone, from going in and out all over the place, okay? It kind of acts as a shock absorber, and it helps keep the joint located. The rotator cuff, which we already went over, is another diagram there just showing some injuries. So let's start with rotator cuff first. So there's a lot of, it's very complicated because our shoulder has so many degrees of motion, forward, backwards, twisting, sideways, compared to your hip and even your knee. So we sacrifice stability because of, I guess you could say, because of our many degrees of rotation, we sacrifice stability. So the shoulder is the most prone to these types of injuries, way more than the hip or the knee or the ankle or anything else. What are some of the things? Primary impingement. This is not common in kids, and this usually happens later on. Primary impingement, and that's where the rotator cuff is rubbing right up here underneath this arch. This is something that happens when you get older primarily. Secondary impingement is because your joint is not tight and it's shucking around everywhere, it moves back and impinges, and then it moves in the front and impinges, and that's related to instability. The other very common injury in overhead athletes, and when I say overhead, this is baseball, softball, tennis, volleyball, anything that requires a lot of overhead function. These are the kind of injuries that you get. What you can get with rotator cuff is just a simple tendinosis, and it's not that simple because it's very painful. Just like you get it in your Achilles, what happens is because you are requiring so much force on your rotator cuff, you get these small little tears. And I tell people it's like the tear can go down 2 paths. One path is it heals itself and it does fine, and you had a kind of a shoulder ache and it got better. The other path is that it started doing bad things. It brought in a bunch of its friends, it started eating itself. It's called that's what tendinosis is where the collagen breaks down and you can get an increase in tear, or it's just almost so hard for it to get to heal. And that's very common in rotator cuffs. When people like in baseball have a shoulder strain, oftentimes, and they take them out, from pro sports or college or whatever, it's because they have rotator cuff tendinosis.